Great. So this is an opportunity for us to sort of have a bit of a discussion in a smaller group, and I'm sure people will be interested in hearing more from John and have questions, and maybe we'll just have a discussion between us. So we are going to, there's not too many of us. I was going to suggest if you wanted to sort of ask a question to wave your hand. We'll start off doing that just so that we can kind of, so everyone's sort of shouting at once, but I think there's not that many of us, so you can probably just chip into the conversation as well. I won't go round and do sort of full introductions just in the interest of time, but when you sort of do contribute for the first time, if you want to sort of let us know where you're joining us from, I think that's really helpful for everyone for context. So as you can see, we're joined by John, and we've just heard about John's fantastic work. So we're going to have an opportunity to ask him some more questions and dig into some of the details. So I don't know if anyone's got any questions they want to start off with, or John, perhaps if you want to just, if there's anything you want to share you've not already shared.
I've completely misrepresented everything in that presentation. The reason why I say this is that I'm fronting up the activities of a whole bunch of people in third sector. So it's wrong for us to claim it's like LAS and on Leeds Asylum Support Network on our own. It's a whole network of people who've been involved in doing this. And so my key message, if you like, is that third sector partners can really help to like sort stuff out quite quickly, and we can do we can achieve quite a lot that some of our statutory mates find quite tricky. I had a whole thing about that in my spiel, but I forgot to talk about while I was running out of time.
So it was very quick.
Yeah, so it does go really quick. So just very, very briefly, one of the big stories is we managed to get out 100 old phones to people that were found in a cupboard in a local authority. They didn't know what to do with them. They were going to go to landfill. And so we wiped them, we unlocked them, we got them out to people. And we were able to do that super fast to people who had no way of getting online. And our statutory mates couldn't do that. We could, and they trusted us to do it, and we did it. And so, yeah. So anyway, I just thought I'd share that with the group. Thank you.
Thanks, John. I think that's really interesting. What do you think? Sorry, I'll let everyone else go to questions. I guess I'm interested in maybe why you think it is that third sector can manage to achieve these things and not the statutory partners. But we could come back to that. Has anyone got any burning questions for John or anything to start us off?
I think you should unmute yourselves, all of you.
Yeah, I think it's fine. There's not too many of us.
No gods, no masters.
We can cope, can't we, John?
Yeah. I'd like to ask a question. Can you hear me?
Yeah.
I'm Christina. I'm the head of patient experience at Leeds Teaching Hospitals, John. I was fascinated by hearing your work. I mean, I'm hearing a lot of this kind of thing, to be fair. I'm hooked into the Health Watch piece of work, which is a big piece of work that's going on you'll be aware of. So a lot of the principles of what you're talking about are not unfamiliar to me. Our challenges in the organisation, you know, I work in a massive organisation with 17,000 staff in our trust. So I'm one person who's sitting here hearing all of this information, albeit that I lead a team of people, but infiltrating out to all the clinicians, all the nurses, everybody who's caring for patients is quite tricky. You know, we are interacting with people, as you know, through things like video consultation, that kind of thing. But the data that we're having difficulty accessing right now, just because we're at the beginning of this journey and we haven't got around to it, is we don't really understand the extent of people or the type of people who are DNAing our health appointments, who are not engaging. So we know that there are a proportion of people not engaging, but we don't necessarily collect demographic information on all of those at the minute. So I guess I'm interested with your intelligence from the other side, so to speak, what you think we could practically do differently to support the groups of people that you're so understanding of, so that we get it right as we're setting up our systems and working forward from here.
I don't know how practical this is. I'd like to think it was super practical, but I'll tell you what we do as an organisation. So a small organisation, we turn about £250,000 a year. We support about 250 people. So just more than about 300 plus their families. What we've said is that if you're working with us, then we give you £5 a month towards your telephone costs. Actually, we've upped it to 10 recently. So what that should do is that gives you the ability to engage with us. We see it as a requirement that you should have enough money to be on a call, because here's the thing with data, video calls, right? If you're on a pay-as-you-go SIM deal for £5 a month, which is what a lot of people are, you get about 2 gigabytes of data. Everyone using video with poor people should know how much data is used in a half-hour consultation.
Okay.
So I don't know how, so in terms of like how much data, I'll tell you, half an hour's worth of Zoom call or consultation or Skype, they're all pretty much the same.
Yeah.
Will cost you about half of your data for a month.
Really?
Yeah.
So much? Right, okay. That's
so when you're
significant.
unlimited and you've got like 2 gig of data to see you through for everything, and then you've got to go on for half an hour to someone, and he's going to use up half of your data, that's got to be a really important call. Or else you're going to, like, kids need to watch Peppa Pig, right? Or whatever it is that you need to do.
Yeah. Mm-hmm.
So it's a huge investment. So I think that we don't understand a lot of the time. And remember, you're on 38 quid a week. So it's an enormous part of your cost. Even if you were to get the best possible deal at like 20 quid a month for unlimited data, that's still an eighth of your monthly income just on data.
So does getting access to kit less limiting than poverty? Clearly. So I think we make some assumption that we're told actually that people don't have access to kit.
Yeah,
I think what you're suggesting is if there isn't kit is less of a problem, it's the money to pay for contract or pay as you go, that kind of stuff.
It's both and, isn't it? So you can't cook if you haven't got a pan, but you can't cook if you haven't got anything to put in your pan. So you need pan and food to be able to make a meal, right?
Yeah,
so it's neither one thing nor the other.
What's the, the way you were speaking at the beginning, John, seemed to infer people had the facility, they just couldn't afford to pay to keep it going, but no, that's clearly not right.
So the first thing I said was around sort of providing people with computers who didn't have any access to anything.
Right.
And then the second thing that I said was around the computer kit and the connectivity. It's neither, but and both of them, And what I would say is it's probably cheaper for trusts to give out money to people to help. Actually, I don't think it's the trust job. I think it's central government, frankly. But I think it's a job to resource people, to give them the ability to be able to get online. And if you're requiring them or setting up things to be able to have those conversations, I don't know, one device could serve 4 people potentially, in a household. It's not perfect, but it's better than nothing. It might be easier just to knock out £5 a month for the people who are engaging with you, in the same way that my mother-in-law used to get money towards her lecky costs. The challenge is all the trusts always say, well, how do we know they're going to spend it on the consultations and not run away and do something interesting and useful with it? Why should they speak to their family? They should be speaking to their doctor or their nurse. They're not even compliant. You hear the stories, don't you, already?
Yeah, I think less about that. But I do hear a lot about privacy coming up in conversations, so that in shared accommodation, that kind of thing, privacy is also a factor, and it limits people's desire to engage with us if they haven't got private space. But I've probably taken up more of your time, and I'll let others jump in, John, but that's really interesting. It's an interesting perspective. I don't think we've thought about the financial, well, we've thought about poverty, but I don't think we've thought about what the solution is in terms of supporting our patients. Thank you.
Zoom calls, say hello, then turn off your video, have your chat, then turn it on again at the end. Uses loads less data. It's just about being thoughtful.
Okay, thanks.
Cool, thank you. Cheers, Christine.
Does anyone else have any questions they want to add in? Or comments or thoughts? Just pop yourself off mute if you do.
I've stunned you all into silence. Don't blame you, frankly. Talking about data is really dull. I think we should just pipe it into people's houses like water.
Yeah, it just shouldn't even be something we need to discuss, should it?
Yeah, It's rubbish. I run a refugee organisation. I don't know anything about data. Why should I know anything about data? Neither should you. Frankly.
I think that's the problem, John, kind of that information you just said at the beginning around it takes so much data it eats up so much data to do a call. That's not common knowledge. I would say that I mean, everybody on my team knows this about me. I'm so digitally inept But
Fair enough.
it's a complete challenge to get me to do anything, including Zoom and all the rest of it. It was a real big deal for me. But the point is, we're now in this digital world where we're having to come up with working differently. And for some professionals like me who are put in this situation of having to come up with some of those solutions, you know, what you're saying is quite true. You do need to hook into people who know that information in order to make the sensible decisions, because we haven't lived and breathed it and we're not carrying it with us. And yet we're faced with having to create healthcare solutions that work. So I think your expertise is probably really important right now, to be fair.
But there's massive irony in this, because all we'd ever do is we talk about the lack of digital literacy amongst the clients, right? Amongst the poor people, about the people who are sick and infirm and all the rest of it. When in actual fact, most of us are functionally illiterate. And I think as soon as we start to grapple with that, and just because we're of a different class or a different income bracket, doesn't mean it's any different in some respects. So we just need to have a bit of humility and go, actually, we haven't got a clue.
Yeah,
I reckon.
I agree. Yeah, and I think we're almost. A lot of people are fearful of saying that, John, aren't they? I think you're right. Yeah.
People don't like talking about class, they don't like talking about money, they don't like talking about poverty, and they don't like acknowledging the fact that they have substantially more privilege than the people that they work with.
Yeah.
That's the issue. So you need to call it out. I call it out. I'm fine. But that's also a function of a privilege, right?
Yeah. Completely, 100%.
Anyway.
We're going to be pulled out in about 20-30 seconds, so if anyone's got any last remarks, I'd get them in.
Thanks though, John. Fascinating. Thank you very much.
I put a link in the chat about video calls and mobile data.
Oh, fab. That's really helpful.
Wonderful. Thanks.
Talk to me outside if you want to.
I'm going to be asked to give a sort of a headline from this, and I'm going to mention the thing you said about the cost of data.